Morning, everybody. I hope you guys are good depending on where you are in the country. I'm Dr. Malik, urologist and pelvic surgeon, and today we are live answering your questions about Ask Anything. So I hope you're all doing really well today. At the point in the midway, I will be, let me just, sorry, hold this up here. Okay. I will be taking questions and also giving some advice. Let me just make sure this is working okay here. Uh, says I'm live, so hopefully it is. Can someone send me a message in the chat so I can see? Okay, great. I'm seeing some chat messages. Wonderful. So anyways, let's get started. I'm going to answer some questions from Instagram, some questions from my community post, and then I will answer some questions here as well. So on Instagram, I got a question. I have the urge to pee, but when I get to the restroom, it takes some time to do. Is this normal? So I'm assuming this is a male because the picture of the person is male. And that's actually a very common problem, particularly in men as they age. The stream is a bit choppy and laggy. Okay. All right, I apologize for that. I have good speeds, but hopefully it's not too bad. So, why would you have the urge to pee and then when you get there, your stream is slow? Most often, this is because of an enlarged prostate. When you have an enlarged prostate, which is the organ that sits underneath the bladder, it's like a walnut-shaped organ, and it can grow and then block the flow of urine. So, when it blocks the flow of urine, it can also make your bladder more reactive. So, it can make the bladder feel like it has to go really, really bad, but then when you actually go, because the prostate is enlarged, the stream is slower is called benign prostatic hyperplasia. Is very common. In fact, people who have about 80% of men at the age of 80 have BPH, not everyone has symptoms, but certainly it can be a problem. So let's move on to the next question. If you have an enlarged prostate, check up on everything you need to know about BPH, and then you'll be able to are for treatment, medication wise, not medication wise, conservative management and surgery. And yet you can have a TURP procedure as well, which Pete mentioned here. Um, oh, I'm sorry that you're experiencing hip pain. That's not typical, but I would absolutely call your urologist and let them know. Another question I see here. I'm a junior doctor in the NHS considering urology to specialize in. Could you please tell me your thought process to go into urology and what other specialties you were considering? I would be happy to answer this question. I'm sorry, guys. I think I have a little bit of a cough. I forgot to bring my tea down with me. But the reason I went into urology, I actually never thought about urology. I really thought I'd be like a cardiologist or a general doctor, like a primary care doctor, or like a GI doctor. But when I did my surgery rotation, I was very surprised that I enjoyed surgery, but I didn't want to be a general surgeon necessarily. So I looked at all the subspecialties, which included, like, for those of you who don't know, orthopedic surgery, ear, nose, and throat surgeons, urology, ophthalmology, so eye surgeons. And I went into the operating room with many of the surgeons, and I really found urology to be the most compelling in terms of the kinds of surgeries we did. And also, I really just liked the people. And I would tell anyone who's a student that is thinking about going into urology or any specialty is that a lot of the times you're just kind of jumping in because you get exposed to it for such a short time. But I will say, find tribe, find the people you enjoy working with because you spend so much time with them. I'm going to answer more from Instagram and I'm going to community poll, and I'll answer your guys' questions. Also, I have disease, but is a slight curve okay? I have issues. So is the curvature of the penis due to plaque buildup, a fibrous plaque that builds up on the erectile tissue of the penis. So this can happen due to, multiple micro traumas over the course of a long period of time. Sometimes we don't know why it happens. There can be a genetic component. So some people have contractures in their hands and they can also develop them in their penis. Now, is it dangerous? No, it's not dangerous. If you have a curve and you don't have a problem with it, there is nothing you need to do. You just, go ahead about your life and have no problems. If it is bothering you, there are a host of treatment options available. Some of them don't require surgery, so you can use things like traction devices or injections. So check out my video on Peyronie's disease where I go into that, or curved penis, where I go into that in a bit more detail. All right, let's go to the community poll. Thank you guys. Sorry that the feed is choppy. I'm trying this new streaming platform, and maybe that's why it's a little bit choppy. Um, so, in my community poll, someone asked, can you discuss the health consequences or benefits of engaging in water sports? So, this is a great question. If you are engaging in sexual activity in water, what is the concern? Well, certainly water itself has bacteria in it and it can put you at risk for getting infections. And also, if you're engaging in water sports, it can also be more difficult to use protection like condoms, or dental dams are maybe a little bit easier, but it can be a little bit more difficult. And so many people don't use protection in the water, but water itself is not protective. You do need to continue using any sort of barrier protection to protect from sexually transmitted infections. So that is the most important thing you need to know about engaging in water sports. But I would refer you to my video about pool sex, where you can learn more about it. All right, next question. Um, So, can you discuss all the pros and cons of NoFap? Is NoFap for a long time dangerous for the sperm? So, NoFap is essentially a terminology meaning that you don't ejaculate for several periods of time. Many people claim that there are lots of benefits, like it improves your focus, it improves your energy, you feel better, you feel more spiritually in tuned, or whatever. I don't doubt that some people do achieve those benefits. However, scientifically, there is no benefit to actually abstaining from masturbation or ejaculation. In this case, ejaculation specifically. There is a very small study with 10 young men that showed a very small increase in testosterone. And so a lot of people also say that it may increase testosterone. But again, that study was extremely small on a very small subset of men. And so to this day, there has been no other scientific, rigorously studied evidence that proves benefit to it. Also, there are some data that I'm, looking into that shows that these no-fap communities are actually sort of negative and have been leading some people to violence. And so I don't know the specifics on that, but I would be cautious based on what I've heard and read in the scientific literature. And it is not dangerous for your sperm. If you don't ejaculate, your body will either reabsorb it, or you will ejaculate at night when you are sleeping. And so that's called a nocturnal tumescence, which leads to ejaculation, and it is normal and healthy and not a problem at all. Okay, one more from the community post, and then I will answer your questions. Okay, this is a great question. I'm using tamsulosin. So tamsulosin is a medication that people are prescribed for an enlarged prostate, and it helps you urinate better. And he says there is no discharge when I ejaculate. If I understand correctly, the contents go into the bladder, and that is correct. When you take a medication like tamsulosin, alfuzosin, doxazosin, all of these have a small risk of retrograde ejaculation, some higher than others, which means that when you ejaculate, either the ejaculate doesn't come out, or that's anejaculation, or it goes retrograde into the bladder. So, is it harmful to have those contents in the bladder if you don't have to urinate afterwards? So, no, it's not harmful. It's not going to hurt you in any ways. And this is not dangerous. The only downside is, one, some people do find pleasure from having an ejaculate. And two, is that if you're trying to get pregnant or get somebody pregnant, then you will not be able to, and you will need to try alternative means, like go see an infertility specialist where they can take that urine and isolate sperm from. All right, so I'm going to come back here and answer some questions from you guys as well. I appreciate you all so much. My apologies. There's so many here. Okay, so coming from the start, arginine, L-citrulline, or even taurine assist with loss of clitoral feeling or loss of sexual satisfaction brought on by taking an SSRI. So this is not something that is unheard of. Certainly, there is some genital sensation dampening in some people taking SSRIs. SSRIs are medications for antidepressants. If you are, the best thing first is to talk to your psychologist or psychiatrist or primary care doctor and see if you can reduce the dose, because it is dose dependent, meaning that if you are taking a medication, and you reduce the dose, particularly SSRIs, it can reduce the side effects. Or if you can switch to another medication like bupropion, which doesn't have these side effects. The second thing is if you're having issues with genital numbness, you can try a variety of things. So L-arginine or L-citrulline help with nitric oxide, and so they can help with the clitoral and having erections of the clitoris as well as erections of the penis. So it can help with that. There are also FDA-approved medications, or you can PDE5 inhibitors off label. So Viagra and Cialis, those help with blood flow to the area, which may help with sensation. And these off-label medications are more so kind of work on the brain, but may also help with some symptoms. Again, they were these medications are called C and flibanserin or Addy and bremelanotide, and these help with essentially desire. And so they're prescribed for premenopausal women with low desire, but they may help with this as well. Although they're not covered by insurance and they can be a little bit expensive, it may be valuable. Another question here is frequent masturbation necessary for reducing the risk of prostate cancer? So the answer is no, it is not necessary. There is a study that showed that men who ejaculated more than 21 times a month had a reduced risk of prostate cancer, reduced incidence of prostate cancer, but this is not necessary to reduce the risk. Now, there's probably other confounding factors in those patients because they were able to ejaculate 21 times a month. Maybe they were having more intimacy with a partner, maybe who knows? But again, they're not as ill because they're able to masturbate more often. So I think there are some other confounders. Um, okay, let's see. There's another question here. Thank you so much, Derek, for your comment. I really appreciate it. Okay, let's see here. Does Longjack work? So Longjack is the kind of generic name for Tongkat Ali. An entire video about Tongkat Ali. There's some data that suggests it may help with increasing testosterone. Does it have side effects? I think they're pretty much not too rigorous. But again, when you buy anything over the counter, it is not regulated. So no one is watching what they put in that pill or that powder. It could be sawdust, it could be anything. And so, to be quite honest, I don't recommend as a physician to take something that's not regulated, but there is some scientific data on Tongkat Ali that may show a benefit. Okay, let's see some more here. How often would you recommend getting bladder Botox surgery for overactive bladder? I'm concerned about having too much Botox in my system, and how effective is tamsulosin for overactive bladder? Overactive bladder is a constellation of symptoms that includes the urgency to urinate, gotta go, gotta go. Sometimes that leads to leaking, sometimes that doesn't. Frequently going more than 8 times a day. Nocturia, sometimes getting pee more than once at night. And so all of those things taken together for active bladder. Botox is a very effective treatment for overactive bladder. It's when essentially Botox is injected into the bladder every 6 months to 9 months to 12 months, depending on your own. Essentially, it is injected in the bladder, relieves those symptoms, usually a period of 6 to 12 months, and on average, Most people land somewhere between 6 to 9 months. So it wears off and it disappears from your system. So when you have symptom recurrence, it is very reasonable to go ahead and get it again. Tamsulosin is not a treatment for overactive bladder. It is a treatment for enlarged prostate. Now, if you are a male or somebody with a prostate, you can use tamsulosin and it will improve your overactive bladder symptoms because an enlarged prostate is often the cause of the overactive bladder symptoms in men, but it is not effective for overactive bladder from other etiologies. Okay. Um, let's see. Um, all right, let's see what else have we got here. Um, there's a question here. I did not with DCVA. I didn't live in DC. I was in Maryland. Thanks for the question. Someone asked, I'm jealous that you will be on the left West Coast. I have just moved to California, and in fact, that was one of my announcements today. I have moved to California. I am now seeing patients in my own practice in Newport Beach, as well as telemedicine patients in the states of California, of course, Florida, Illinois, New York, New Jersey, Texas. So I'm licensed to see patients and provide medical care to patients in all of those states. If you are not in those states, I can still see you for an educational visit. What that means is we can talk just like I'm talking now and answer questions about general health. I can't specifically give you a diagnosis or offer or prescribe you treatment, but it may help you get information that you can take home to your urologist or your doctor and talk about options as well. So that's one announcement. I have another couple announcements. A second announcement is that I will be starting a podcast, and I would love to hear the things you want to hear about in the podcast. It will be sort of a discussion about, long form conversations, sort of like this. It'll be on YouTube. So certainly if you're on YouTube and that's where you prefer to consume content, you can still come here where I'll be going over some of the topics I've already made videos on in more detail so that you have kind of a reference to go there. I'll also have guests on and experts. So I'd love to know if there are any experts that you'd like to hear from. Also, I'd love to just hear from people who have interesting stories and interesting life experience to share with you if that's something you're interested in as well. And excuse me. Uh, and then lastly, of course, I would love it if you are enjoying my content that you would subscribe. We are, almost to 2 million. Like it's not that far away. It's really exciting. So it would just really be an honor. You could subscribe. And if you're already subscribed, share this with somebody who might need it because this content is so valuable for so many people. So many people go years without talking to their urologist or talking to a doctor about issues that they are experiencing. So I think it's really important that people have access to free education, which is why I do this. Okay. Let's see. Um, this is an interesting question. After I ejaculate and try to pee, it takes a long time for pee to come out. Is that normal? So actually, this is kind of interesting. So some people will complain of a split stream or having a sprayed stream, particularly after because some of the semen or ejaculate gets kind of stuck in the urethra and can make it either difficult to urinate or it can make the stream be a little bit sprayed. So yes, it can be normal, not nothing to be worried about. If you have persistent issues with urination, then absolutely see your doctor. Okay. There's a question of hydronephrosis causing paresthesia in face and feet. No, not cause paresthesias in face and feet. Hydronephrosis is swelling of the kidney, and it can essentially cause issues with kidney function. So you can have symptoms that are associated with abnormal kidney, not with paresthesias or not. Okay, let's see here. All right. Is shockwave therapy good for increasing size? No, shockwave therapy is a treatment that somebody asked about Brian Johnson. Again, I'm sorry the video is lagging. I should fix the bit rate or something on here. I need to figure this out. But shockwave therapy is essentially a treatment where you deliver um, low intensity shockwave, focused shockwaves to the penis across multiple areas, like 6 areas, that then causes trauma to the area that tells the body to create new blood vessels to that area. And so helps rebuild those areas. And it has been used for erectile dysfunction. It is actually used, has been studied, relatively quite, there's a lot of studies now. It is not yet recommended by the major societies, sexual medicine societies in the United States. Europe, it is actually recommended. So help. Um, it can help some people regain erectile function, particularly those with mild to moderate erectile dysfunction, meaning that issues sustaining an erect, but it's not always, or it's very early in that time period where you're starting to notice some difficulty with erections. But as you get more severe, or if you're diabetic or have had prostate cancer, it may not as well for you. And I don't know the kind of protocol people need to take for shockwave. So should you take it every week for 12 weeks, and then after that, what should you have it every year? We still don't really know the exact protocol that's correct. And so based on initial protocols, which are kind of like a short period for 6 to 12 weeks, getting it regularly, they've seen about 50% success at 1 year. So probably we probably do need some sort of kind of maintenance therapy. All right, so let's see what else have we got here. We're gonna go for maybe 5 more minutes, so maybe 2 more questions. I have a question here on prone masturbation. Prone masturbation is fine, but it can cause some trauma to. It can make it difficult for some men to obtain an erection or the same sort of stimulation when you're with a partner. And so I recommend in general to not, I don't recommend to, um, to then do it all the time the same way. In general, you need to sort of think about alternative ways to get stimulation and not be sort of stimulating yourself the same way every time, because the body gets used to it and it makes it more difficult to get erections, maintain erections, or become even aroused with your partner or other people. All right, let's see what else we have here. Is gynecomastia related to testicular health? So, gynecomastia is an enlargement of the breast, can be a sign that there is a problem in the in your endocrine system. So it can be a sign of elevated prolactin. It can be a sign when you're taking exogenous testosterone. Sometimes it can convert uh, too much to estrogen and cause gynecomastia. And so that is sort of how it's related to testicular health. Okay, so let's see what else. Let me do one more question. Um, okay. Uh, all right, guys, give me a good question here. Let's see. Someone keeps asking about testicular scrotum stretching and saline infusion. So I know that there's a big community out there that likes to stretch their testicles with saline infusion. I don't recommend it. You're putting potentially unsterile fluid in an unsterile way into your body. So I certainly don't recommend it. I think that's is not safe in those circumstances. Can a I've been taking male enhancement for sex with blood pressure meds, but going without them and it's not the same strength. What can I do? So if you're having concerns about a and you are having issues with your blood pressure, likely the cause is either the medications or your blood pressure or both. So the first and most important thing you can do is get your blood pressure under control. Talk to your doctor about the medication, see if erectile dysfunction is a cause of the medication and see if you can switch. And then ultimately, you could take other medications like PDE5 inhibitors like Viagra, Cialis, those sorts of things. Or there are a whole host of other treatment options that are not medication related that you can see on my video about erectile dysfunction. And I'll post all the links to these videos that I've talked about today in the comments, in the description. So ultimately, I think, you know, the big thing about erectile dysfunction is everyone wants to know, like, why is this happening to me and why is it not getting better? So erectile dysfunction is a problem most often due to poor blood flow to the area. And most commonly, that's due to issues of comorbid conditions. So like you have diabetes, you have high blood pressure, you have conditions that are caused by decreased blood flow to the area. In fact, when you have erectile dysfunction, it can be the first sign that you are going to have heart disease down the line, because it could be that those blood vessels are much smaller than the blood vessels to your heart. And so they're the first to be affected when you're having blockages in your arteries. So the best way, guys, to improve erections is improve your diet and exercise. Essentially, anything you would do for your heart, right, to improve your heart health is going to improve your genital health and your sexual health. All right, guys, thank you so much. I will work on fixing my bit rate next time. Hopefully, we won't have any lagging issues. Thanks so much for coming. And again, please subscribe. I'm in the comments where you can make an appointment with me if you'd like to see me. And also in the comments, please let me know who